Hyperlipidemia pharmacology. Prior to understand the pharmacotherapy of the disorders, we need to understand the functioning of the major lipoproteins. Because lipid molecules are not soluble in plasma, so they need help with the transportation. So now, to transport the lipid molecules, lipoproteins help them. So lipoproteins help the transportation of the lipid molecules throughout the body, such as HDL. HDL is manufactured in the liver and in the small intestine. So, what does it do? It helps the transport of the cholesterol away from the body tissues and takes it back to the liver. So, this process is called reverse cholesterol transport. So HDL, it takes the cholesterol away from the body tissues back to the liver, and where the cholesterol component of the HDL is broken down to mix with the bile, and then it gets secreted into the stools. So why called good cholesterol? Because HDL, it removes the cholesterol from the body. That is why it is called good cholesterol. On the other side, LDL. LDL, it transports the cholesterol from the liver to the tissues and to the body organs, where it is utilized for the, building plasma membranes or the synthesis of the steroids. And the extra cholesterol, it is stored into the tissues for later use. So why called bad cholesterol? Because it helps in the storage of the cholesterol, and storing the cholesterol into the blood vessel linings is not desirable. It may cause coronary artery disease or atherosclerosis. So that is why it is called a bad cholesterol, because it's creates the potential for the client to develop coronary artery disease or atherosclerosis. Lastly, we have here is VLDL, that is very low density lipoprotein, and this one is usually a primary carrier for the triglycerides in the blood. Triglycerides in the blood. So this is the one for the VLDL, very low density lipoprotein. Drugs for dyslipidemia. So first of all, we have hydroxymethyl glycerol coenzymes reductase inhibitors. These drugs mostly ends with the statin, the word statin, such as fluvastatin. Then it can be pravastatin. It could be lovastatin, or it can be simvastatin. Another side, we have bile acid binding agents. Those are, the first one we have is fenofibrate, and then we have cholestyramine. These are the ones those are bile acid binding agents. Then we have the nursing considerations. First of all is the liver function test. So prior to starting any client on a statin drugs, we want to check the liver function testing, because the statins, they for the prolonged use of the statins may cause a liver dysfunctioning. So that is why liver function testing prior to the therapy, during the therapy is recommended. Then we have the lifestyle changes. So for the lifestyle changes, implement the medical supervised exercise plan for the client, and instruct the client to avoid alcohol intake, and increase the soluble fiber in the diet, such as eating more oat brands, broccolis, or beans, and reduce the dietary saturated fat, cholesterol, and trans fatty acids. Avoid the grapefruit juice, as this juice reduces the metabolism of the statins and it causes a toxicity of statins. So this is why grapefruit is avoided. Pregnancy category. Statin drugs are pregnancy category X. So that means these drugs are should not be given to the pregnant client, to the lactating mothers, and also the clients who may become pregnant. So these are not statins are not recommended. Over the counter drugs. Instruct the client not to take any over the counter medications, herbal supplements, or the vitamins without consulting the physician. Symptoms to report. Advise the client to report sudden or unexplained weakness, sudden or unexplained fatigue, numbness in the hands or feet, because the statin drugs, they may cause a myopathy. So that is why we should be closely monitoring the client for all these symptoms. Next, we have biosynthesis. Statin drugs can be taken anytime during the day, but evening meal taken during the evening meal is recommended because it helps with the two things. It helps to decrease the stomach upset with the statin drugs, and also the biosynthesis in the body is higher at night. So that is why we recommend the client to take statin drugs at with the evening meals. So that's all about statins. Thank you for listening.